Hello, I'm Tom, and today I'm going to talk to you about hypertension. Hypertension is a major risk factor for stroke and heart disease and is therefore one of the most preventable causes of premature death in developed and developing countries. In the UK, hypertension is the third biggest risk factor for premature death and disability after smoking and diet. Hypertension is also commonly referred to as high blood pressure. High blood pressure happens when the force on the walls of blood vessels is higher than normal. This means the heart has to work harder and the blood vessels are under more strain, which can lead to health issues. There are modifiable risk factors which include excess weight, excess dietary salt intake, lack of physical activity, excessive alcohol intake, and stress. And there are also non-modifiable risk factors which are old age, family history, ethnicity, and gender. Gender is because blood pressure tends to be higher in men than in women up to the age of 65 years, whereas the opposite tends to be true over the age of 65 years. Hypertension is often symptomless, so screening is vital before any damage is done. All adults should have their blood pressure measured at least every 5 years up to the age of 80 years, and at least annually thereafter. To learn more about how to take and read your own blood pressure, you can watch the video on our channel which takes you through the steps on how to do this. If you have any other questions regarding your blood pressure, please consult your GP to discuss further with them. Our blood pressure reading will have two figures, one over the other. For example, 140 over 80. The higher figure is a measure of the pressure inside your arteries when your heart is pumping blood out. The lower figure is a measure of the pressure inside your arteries when your heart is resting between beats. Blood pressure is measured in millimetres of mercury. A one-off blood pressure reading that is high does not mean that you have high blood pressure. Your blood pressure varies throughout the day. It may be high for a short time if you are anxious, stressed, or have just been exercising. If your readings are consistently high, then there are ways of bringing it down, as covered in the modifiable risk factors. But it can also be useful to discuss it with your practice, because the sooner any potential issues are identified, the easier it will be to diagnose and treat them. Thanks for watching. If you found this video useful today, please like, share and subscribe for more from Health Friendly. Thank you.